Imagine a world where every cut of a surgeon's blade brought immense pain, and survival often came at the cost of unbearable suffering. This was the situation before the discovery of anesthesia. Patients endured unimaginable pain during surgical procedures. Surgical operations were brutal, pushing human endurance to its limits. Doctors performed complex surgeries with patients fully awake, often restrained by multiple assistants to prevent any movement. In the words of James Simpson, the inventor of chloroform, the pain of surgery is in itself so great that without the aid of anesthesia, the mere anticipation of it was enough to bring on a mental and physical collapse. As you can infer from the quote, anesthesia changed surgery from suffering to salvation. Anesthesia has saved countless lives since its invention by relieving pain and letting doctors perform surgeries that would have otherwise been impossible.
However long a surgery goes, however extensive the surgery is, anesthesia is so refined that none of these patients know anything, will not feel even the slightest of the pain. Even if you're cutting deep into the abdomen, deep into the heart, they don't have any slightest of the pain. And even if the procedure goes on hours and hours, they don't remember anything. And at the end of the surgery, they won't be able to recall anything. So pain, sleep, and no recalling. These are all very standards of anesthesia care.
So what exactly is anesthesia? It is a drug that results in the temporary loss of sensation that is induced for medical purposes and is completely irreversible after the completion of a procedure. It's the right of every person to use anesthesia for legitimate purposes and the responsibility of us all to use it properly. Before anesthesia, methods to manage pain during surgery included opiates, alcohol, and hypnosis, but they were largely ineffective. Alcohol's dosage varied per person and interacted with other medications. Opiates were addictive and hypnosis was unreliable. Surgery, often essential for survival, was like torture without effective pain management. Thus, anesthesia was a revolutionary invention. Horace Wells, a dentist, is considered to be the real father of anesthesiology, though there is some debate. In 1845, Wells attended a nitrous oxide party where people inhaled nitrous oxide from a paper bag. At the party, a woman hit her leg against a table, causing a deep laceration, but felt no pain. Wells linked this to the nitrous oxide that she had inhaled. To test it, he underwent a tooth extraction under nitrous oxide and felt no pain. In 1846, he used nitrous oxide as a sedative in surgery at Massachusetts General Hospital, but the patient cried in extreme pain during the operation. Humiliated, Wells later ended his life. Later in October of the same year, William Morton successfully demonstrated using ether as anesthesia in a surgery to remove a neck tumor. Though his journey with anesthesia and claims about the discovery of ether as an anesthetic ended up in controversies, he certainly has shed some more light on the usage of ether and was indirectly a reason for further studies and developments in this area. James Young Simpson was a Scottish obstetrician who was best known for discovering the anesthetic properties of chloroform in 1847. His work significantly advanced the field of anesthesia, making surgeries much safer and less painful for patients. John Snow, a physician from England, has also done a significant contribution to the world of anesthesia, especially obstetric anesthesia. John Snow was one of the first physicians to study and calculate dosages for the use of ether and chloroform as surgical anesthetics, allowing patients to undergo surgical and obstetric procedures. In 1853, he administered chloroform to Queen Victoria during the delivery of her 8th child. In the late 19th century, the renowned psychologist Sigmund Freud delved into cocaine's potential in medicine. Freud's initial studies highlighted cocaine's unique properties for medical use. His work showed its ability to block nerve sensations, a key discovery for local anesthetics. This breakthrough was crucial for developing new pain relief methods in surgery. Following Freud's research, medical professionals created safe alternatives to cocaine, leading to the creation of Procaine. Procaine offered similar pain-blocking effects, but with fewer side effects, making it safer for medical use. By the early 20th century, the field of local anesthetics had seen a major transformation. The mid-20th century marked a significant era in the advancement of anesthetics. the introduction of intravenous anesthetics such as thiopental and methotrexate revolutionized anesthesia practices. These agents allowed for more controlled and safer induction of anesthesia. The development of muscle relaxants further enhanced the safety and effectiveness of anesthesia by providing better muscle relaxation during surgeries. The advent of newer anesthetic agents like propofol in the late 20th century offered rapid onset and shorter duration of action, leading to improved patient outcomes and faster recovery times. Monitoring technologies such as capnography and pulse oximetry significantly reduced anesthesia-related complications by allowing real-time tracking of a patient's vital signs. These advancements collectively transformed anesthesia into a more precise, reliable, and patient-centered practice. Today, the advancements in ultrasound technology enabled anesthesiologists to administer spinal anesthesia by directly passing the needle to the nerve without perforating nerves or hitting blood vessels under direct vision.
Anesthesia is one of the medical field or general field of science which has advanced a lot in the last few decades, and it has made possible so many complex surgeries to happen. Initially, the anesthetic agents itself, a few decades back, were considered to be risky and had to be administered under close supervision. But the current drugs of anesthesia that are available are reasonably safe to be administered. That's one increase in safety. Second, we do have a very, very close and intense monitoring of patient and all the vital parameters of the patient during the entire surgery. You keep monitoring on a lot of patient parameters, and in sometimes very specific parameters, like if you're doing a heart surgery, you keep looking at how is the heart doing and how are certain functions of the heart. If you're doing a brain surgery, you keep looking at certain functions of the brain. So that's how you ensure the safety of the patient. And there have been a lot of advances in what all you monitor in these specific surgery that has helped a lot in improving the patient safety or patient outcomes.
Before any surgery that utilizes anesthesia, the patient has the right to know exactly what will happen. This is known as informed consent. Informed consent is crucial in anesthesia procedures, and the consent information itself must be clear and easily understandable, free from complex medical jargon. Healthcare professionals are responsible for explaining the procedure to the patient or their representative in a clear and concise manner.
You do see the patient at least a day in advance before the surgery. When you see that, you talk to them in detail about what is your plan of managing this patient. That also includes a counseling and assuring the patient that you will certainly take care of things in the operative period or in the perioperative period. So that counseling itself will make a lot of difference.
Access to information regarding the surgical procedure, including observations by trainee doctors for educational purposes, should be restricted to the immediate surgical team. Over 20 states, such as Missouri, Colorado, have laws requiring informed consent when medical students perform pelvic exams on anesthetized patients for educational purposes. States like Oklahoma and Ohio are currently considering bills to protect the rights of anesthetized patients. Anesthesiologists have the crucial responsibility to provide the right dosage of medication along with relevant anesthesia adjuncts. Various factors like the patient's weight, age, medical history, and existing conditions must be thoroughly studied before determining the correct dosage of anesthesia. While underdosing will make the surgery painful for the patient, an overdose may be fatal. Therefore, it's crucial to determine the exact dosage based on individual patients. Anesthesiologists should also closely monitor vital signs to adjust the dosage if necessary. There have been numerous cases and lawsuits filed by patients who experience pain due to underdosing and fatalities due to anesthesia malpractice. Anesthesiologists should also be responsible for not abusing the use of anesthesia. There have been many incidents where anesthesiologists themselves have been addicted to or have died due to the abuse of anesthesia drugs. It's everyone's right to access anesthesia for valid uses, and it's our collective responsibility to ensure that it's used correctly. With continuous advancements in this field, such as the development of new techniques, drugs, and monitoring devices, anesthesia will undoubtedly remain a powerful tool to protect and support patients during their most vulnerable moments.